welcome to another episode of the Granite List Live. And we are live here at SIIA and Engage 2022. And we are so excited to be joined by Lindsay Harris. So Lindsay, do you mind telling our audience a little bit about who you are and what you do?
Certainly. Well, nice to be here. Thanks for having me. I'm Lindsay Harris. I'm the president and CEO of the HMA. HMA is a third-party administrator located in the beautiful Pacific Northwest.
Awesome. So talk a little bit about, our audience is certainly very familiar with third-party administrators and how TPAs function. But tell us what sets you all apart. What differentiators do you have?
Yeah, certainly. Well, we're very fortunate. We are actually backed by an organization called Cambia Health Solutions, which means that we have access to the Blue Network across the country. So we're really excited about that. That gives us a lot of opportunity to find the very best pricing for our customers. We're very engaged in payment integrity work to make sure that we're paying the claims at the right time, and then also really with member support and how we support them from a case management perspective and really through all the aspects of the healthcare journey.
And you all have been fabulous supporters and partners of SIIA. Do you mind telling a little bit about what that journey has looked like for the company and what you've learned from SIIA?
Certainly. So HMA has been a member and a partner of SIIA for many, many years. I think going back almost 20, if my memory serves.
Give or take.
But really, we love coming to the SIIA events, and we really value the partnership for the educational opportunities as well as the networking opportunities that we're able to get being here. There really isn't any other conference I'm aware of that brings together so many different parts of the industry to have dialogue on important topics that we're all facing, and gives us the opportunity to triangulate from different points of view about what's happening and what's coming next. And it gives us the ability to look around the corner.
So I'd love to tell our audience what topics are important to you. What are you here to learn about?
Yeah, I would say this year our focus is really on learning a little bit more on what everyone is seeing and doing with all the new things related to transparency and the No Surprises Act. So with transparency, we just had this flush of data, all these sharing files going to the marketplace. We're curious to see who's using them and what, and anyone actually can get the whole thing. They're certainly very large.
True.
Figuring out what's going on there, and then with the No Surprises Act, I think we're just beginning to see the start of that with claims that are going through the settlement process or even to the dispute resolution process. So we're here to learn to see who's had good experience with that and how it's working, and how do we make sure that we as a company are taking great care of that on behalf of our customers.
Well, I know you do not, it's hard to predict the future. But I think you're right. That's what we're all here to learn about, how we move forward and what that looks like. So what do you see for our industry as we move ahead?
Yeah. Well, I think our industry's been in a state of flux and change for a long time, and I think that's going to continue. First, I would say, I think increasingly what we're seeing is the industry is no longer about paying claims and just being a partner in that regard. Increasingly, we have to do more and engage members earlier in their healthcare journey to affect change and helping them to make the best choices for their healthcare, helping them to find the best places so that they can get the best outcome possible for themselves, as well as really ensure that the plans that we're administering are sustainable financially for the long term. So I think that's just an important thing for all of us. As I think about transparency, one of the things we're here to learn this time, I think we anticipate that over time, pricing may be less of a differentiator for many organizations. And so again, that ability to help members find the best place for care is going to be increasingly important. So thinking about how can we do that, how do we actually get people to make the best choices for themselves in a way that doesn't feel jarring or abrasive to them is really important.
Well, thank you for the role that you play in the self-funded ecosphere. I know it's no small task to be a trailblazing TPA, so thank you for you and your team. Anything you want, any success stories you want to share as we wrap up?
Yeah, I think I would just say from a SIIA perspective, we've had a lot of folks using Canoe, which is the learning system. Really, increasingly folks don't come into insurance thinking that they want to work in insurance. So, and certainly they don't understand TPA and self-funding. And so all the tools that we've had available to us have been certainly very helpful. We leveraged a lot of the resources around what's happening from a legislative perspective as well. So that's been wonderful. For us in success, it's day by day, step by step, trying and testing new things and figuring out what works so that we can do a better job every day for our customers.
Thank you very much. Thanks for sharing your story and your time, and thank you for your support of SIIA. With that, I'm your host, Sally Pace, and thank you for joining us for another episode of the Granite List Live.